Obesity, this is the definition. We're using the NIH definition. So again, I did touch upon this. BMI is not perfect. Again, it doesn't differentiate between types of tissue. It just weighs your overall body. So it doesn't differentiate whether how much muscle or fat you have or your bone density. And it doesn't account for different genetic differences in body composition. So is there a better way? And somebody did mention it during the last lecture, body fat percentage. So body fat percentage, the thing about that is that there are many ways that try to measure body fat percentage with varying accuracy and consistency. So you might have this in your home. Like I have one of these. Like you just step on these little metal plates on your scale and they send a small current and they somehow measure your body fat from that. I don't know the electronics behind that, but that's how it kind of works. And then, or they might just like instead of electrical impedance, they might measure just, I think this is what the military uses, like neck and waist circumference. I don't know if they still use it. I think that. But then skin folds, like if you've gone to, like I have a friend who's a personal trainer, and what they do is it's kind of like when he was testing and getting certified. I mean, he really grabbed my love. He tried to like grab as much of my love handles as possible. I was like, ooh, ow. But the thing about skin folds is like it's also like who's doing the grabbing? Is it my friend who has a death grip, or is it someone who doesn't grip as hot? So yeah. So skin folds, and then hydrostatic weighing. This is a little more accurate. So this is, and it used to be the gold standard. Now they have a little more ways of it. But if they've ever had it, like they measure kind of water displacement, and also you see the scale here as well. And there's also a new, I've never seen this or tried this, air displacement plethysmography. I know I always had trouble with that word. So yeah, this is what we see here. So they're kind of like measuring both the displacement and weight and whatnot. And then this is becoming the gold standard, this dual ray X-ray or dual energy X-ray absorptiometry. So it's, or DEXA for short. And it's interesting because DEXA scan used to be more like, it's something like, especially when diagnosing women who are postmenopausal with osteoporosis, it used to be like mostly for bone density, but you can also get your body fat, overall body composition, like they're using different wavelengths as well. But the thing is like, which is easier? Well, notice that like you would need this sophisticated X-ray machine for DEXA, or you would need this specialized pods. Like, can you have that everywhere in every clinic? Or yeah, so or would it be easier to use a scaler like this? This is why body fat percentage is a more better metric of body composition, but there's so many different ways and so many different accuracies and the overall practicality. Whereas like BMI, again, it's not perfect. It's not the best way to measure things, but all you need is a scale and a ruler, right? Versus this, all this equipment you see here. But again, if you're able to measure it for a study, it's great. But the thing is that like everyone who's studying diabetes and body fat percentage, they're using any combination of these measurements. So the thing is that having a high body composition. So if you have a high body fat percentage, that's linked to prediabetes and type 2 diabetes mellitus. So the more body fat a person has, the more risk they have of developing prediabetes or type 2 diabetes mellitus. And the interesting thing, so you have two people who have the same BMI. And the other interesting thing is like if one has diabetes mellitus, the other doesn't. The person that has diabetes mellitus, on average, has a higher body fat percentage than someone who has the same weight and same BMI. So if they have the same weight and same height, the person who has diabetes is going to have a higher body fat percentage on average. Okay, so then this is when we have to talk about fat. So fat distribution is also linked to type 2 diabetes mellitus, and this is interesting. Like it's hit or miss with this picture. So visceral fat, viscera refers to the organs. So fat distribution, do you tend to pack on your fat toward your abdomen right here, so in the belly and around your viscera, or do you tend to pack on fat like here? So what we have is, instead of being so much around the abdominal, it's more around the buttocks and hips and limbs. So visceral fat is when you have adipose with your organs. So this is what we have there, and this is what they call it apple shaped. I know it's like, so some students get like, it's kind of mixed bag with this, but I use it anyway because I think even public health teaches it this way. And then adipose is stored in your midsection and upper body. So, or if you've ever seen somebody who has like really skinny limbs, but notice that their torso is kind of like relatively bulky compared to their limbs, this is what they call apple shaped. And then subcutaneous fat. So now this is, instead of being on your organs, it's more under the skin, right? So what we have here is that subcutaneous, this is what we call pear shape, or another way I describe it is like, it's like the Kardashians and Jenners. Like they have like, what do you call it? Most of their curves are down here instead of in their limbs. So this is more like the pear shape you see here. So adipose stored in your hips and lower body versus your upper body, so being bottom heavy. And the interesting thing is that the apple shape is linked more to insulin resistance, cardiovascular disease, and type 2 diabetes, mellitus. So this is like the healthier of the two shapes if you're going to pack on fat. And this is the thing, you can't really control where the fat is. It's more about your risk, overall risk. If you tend to put on fat here, or a patient tends to put on fat here, they are at an increased risk of developing all of these symptoms and diseases over here. And yes, for a pack back, 1 question per week. So it's up to 4 questions. You don't have to, like someone else said in chat, if you want to finish pack back early, you do the max 1 question and 4 responses. But it's still, if you want to keep the same pace as last year, where you do, or last semester, where you do 1 question and 3 responses, you'll be done in just under 13 weeks. But if you do 1 question, 4 responses, you'll be done in 10 weeks. And if you do only like 1 question and 2 responses, you're not going to get the max points. So again, it's up to 4. And if you want to take a light week, or if you want to do an intense week, that's up to you. So again, it's still, if you keep the same pace as last year, you'll still reach to 1,500 points. Yeah, so I think the most recent response explains it the best for the pack back. Okay, so then is there a link between type 2 diabetes, mellitus, and adipose? So why is there a link? And one factor is like, okay, why is all this talk about fat and obesity? Well, the thing is that adipose is more than just fat. It's actually an endocrine organ, so it means it produces hormones.